Greetings to all participants. I would like to thank the moderator for the introduction and thank the Ministry of Health and the United Nations Development Program for the invitation to speak with you. Let me just share my screen before we go further. I will be speaking on the priority healthcare waste management issues from a regional perspective and speaking on recommendations for regional cooperation. The UN Development Program, in partnership with the government of China, is conducting research in 5 project countries, namely Cambodia, Laos, PDR, Myanmar, Nepal, and the Philippines. The objective of the study is to better understand the most pressing issues concerning healthcare waste management in the 5 countries. In a later phase of the study, the research team will assess disaster risk reduction for healthcare waste management and will implement behavior insight experiments based on issues identified in the baseline study. Ultimately, the study aims at encouraging more sustainable and strengthened healthcare waste management systems in each country. This slide shows some of the most pressing issues among the 5 countries based on data and information that we have collected and analyzed. These findings have not yet been validated. They will be validated in national workshops, such as the workshop that we are having here today. The study found many challenges in enforcing compliance with national policies and regulations. Unsafe waste handling practices are common. In many settings, there is insufficient supervision and monitoring of workers and insufficient numbers of waste handlers with little opportunity for training. We also found little emphasis on public education that could improve healthcare waste management in households. In terms of processes, poor record keeping and data analysis is very common. There's little emphasis on waste minimization, and very frequently, healthcare facilities lack sufficient financial resources to manage healthcare waste safely. With regards to technology and equipment for collection, transport, and storage is frequently insufficient or poorly maintained. Waste treatment equipment is frequently absent or malfunctioning, and poor waste disposal practices are not uncommon. I discussed our preliminary findings with regional experts whose institutional affiliations are shown in this slide. These experts shared with me their perspectives on regional healthcare waste management issues and advice for regional cooperation to improve healthcare waste management across the Asia-Pacific region. I have distilled the experts' views and advice into a few concise regional priorities and recommendations, which we will see in the next few slides. First, the priority issues. Number 1 is divergence between policies and practices. At country level, every one of the 5 countries has good policies and programs on paper. The implementation of those policies and programs is inconsistent, however, although it is noticeably better in urban healthcare facilities in the Philippines, it should be said. In each of the 5 countries, nonetheless, the study found extensive deficiencies in healthcare waste management practices. These deficiencies were extensive even before COVID-19, and the pandemic exacerbated what was already a bad situation. Number 2, data collection and analysis is insufficient in all 5 countries. Understanding of sector issues and planning for solutions is compromised by this situation. Comparisons among the countries are difficult as well, because they use different definitions of healthcare waste, different methods for data collection, and different methodologies for analysis. The third issue is promotion of non-burn technologies, and I will spend some time talking about this one because it's important and it's a little bit complex. Now, there is no doubt that global warming is driving more frequent and more intense climate-related disasters, including typhoons and rainstorms, that cause flooding and landslides and destroy infrastructure, and also droughts and heat waves. Each of the 5 countries under review are among the most vulnerable to these types of climate-related disasters. The health sector itself is a major contributor of greenhouse gases, which cause global warming and provoke disasters. The NGO Healthcare Without Harm reported in 2019 that if the health sector was a country, it would be the 5th largest emitter of greenhouse gases on the planet. In view of this situation, WHO and Healthcare Without Harm convened the Alliance for Transformative Action on Climate and Health. This was done last year in the 2006 Conference of Parties of the UN Framework Convention on Climate Change, together with the government of the United Kingdom, which hosted the conference. Up to now, 59 countries have committed at ministerial level to realize objectives of the Alliance, which include an objective to achieve low-carbon health systems. Among the 59 countries are Cambodia, Laos, and Nepal. I have no doubt that more countries will make a commitment to the Alliance as well. For this reason, I think it is essential to phase out incineration of healthcare waste as quickly as possible. By using incineration, we are solving one problem, the problem of waste, while contributing to another problem, climate-related disasters. So there is a disconnect between waste management and disaster risk reduction when we use incinerators. If that was not enough justification to phase out incinerators, other disadvantages associated with waste incineration may also be considered. We do not have time to go into a lot of detail, but waste incineration contributes to harmful air pollution unless high temperatures are maintained and effective flue gas treatment is installed and properly operated. But in many resource-limited settings, maintaining those temperatures and maintaining effective flue gas treatment often cannot be guaranteed, especially outside of urban centers. Also, ash from incineration of healthcare waste contains heavy metals and other toxins, which presents a problem with disposal of the ash. I would say one more thing about incinerators. Up to 70% of a hospital's waste stream can be plastic. Incinerating plastic obviously negates any possibility of recycling that plastic, and therefore that increases the demand for production of more plastic products, which are made from petroleum. The production of plastic products has environmental impacts, starting with drilling and extraction of oil, and continuing through the manufacture of the plastic products, which itself depends on the combustion of fossil fuels that increase greenhouse gas and accelerates global warming and climate-related disasters. I'm sure there will be a lot of discussion on this issue. We could spend several days weighing the pros and cons of different waste treatment technologies. However, I feel strongly that incinerators in the health sector must be phased out as quickly as possible for the reasons that I have mentioned here. Going on now, the 4th priority issue is non-segregation of waste. Now, the study found deficiencies in waste management practices to varying degrees among all countries under review, and deficiencies were seen in every step of the waste management chain, from segregation at source to waste collection, waste transport, internal storage, treatment, external storage, and disposal, every step. But because effective segregation of waste at source optimizes every downstream link in the chain, this is the most fundamental step. Deficiencies here are a critical issue. Now, poor segregation of waste at source has been a long-standing issue to varying degrees among each of the countries under review. Challenges in this area certainly continued during the pandemic. Moreover, instances were found during the pandemic where some healthcare facilities made deliberate decisions to treat all healthcare waste as if it was infectious. This was contrary to advice issued by WHO, Healthcare Without Harm, the International Solid Waste Association, and others, which advised that healthcare waste from COVID-19 facilities was no different than waste from any other healthcare facility. Failure to practice segregation at source has greatly increased quantities of infectious waste and has greatly increased treatment costs. Fifth issue that I think is a priority is COVID-19 vaccination waste management. Now, WHO and UNICEF have issued guidelines shown here on the deployment of COVID-19 vaccines, which include guidance on waste management and other logistical guidance. There are just a few points that I would like to make in this slide and in the next. Firstly, all vials used and unused should be tracked and fully accounted for several reasons, including the need to minimize risk of unused vials leaking into the black market and the risk of used vials being involved in counterfeiting of vaccines. Unused vials should be returned to a higher store level, and reverse logistics for vaccination waste, including used vials, should also be considered wherever safe treatment and disposal of waste on site cannot be assured. The second point that I would like to make concerning vaccination waste is that the WHO and UNICEF guidelines advise that planning for waste management should be done from the very beginning when planning the vaccination campaign itself begins. It should not be an afterthought. We found evidence that such planning was undertaken in Nepal and in the Philippines, but there were challenges in implementation due to limitations in human resource and finance. Finally, with respect to treatment of vaccination waste, we received reports of burial on site and burning of vaccination waste on site in all countries except the Philippines. Interim treatment technologies, such as single or dual-use chamber incinerators without flue gas treatment, are also widely in use in all countries under review, except, to our knowledge, in the Philippines. While international best practice calls for phasing out these technologies, in fact, many new incinerators were put into operation during the pandemic, and some were even procured with support from international development partners. I will turn my attention now to recommendations for regional cooperation. The first recommendation is to strengthen collaboration on healthcare waste management among regional development partners themselves. Those focused on health, those focused on the environment, those focused on disaster risk reduction, and urban and rural development. This is for the purpose of sharing knowledge, information, experiences, and tools, and also to develop and optimize synergies in their support to their countries. I think it is especially important to bring together those development partners who support immunization and those who support waste management, because in many instances, the coordination between these two could be greatly improved. Second recommendation is to support low and middle income countries in strengthening capacities for planning, monitoring, and evaluating healthcare waste management systems, including data collection and analysis. This can be done by promoting the development of uniform definitions, uniform indicators, and uniform methodologies for data collection and analysis, and by building capacity for data analysis and planning. Third recommendation is to promote the adoption of policies aimed at reducing volumes of healthcare waste. This could be done through green trade policies, green procurement policies, and promoting circularity in the health sector. For example, by promoting research and innovation in the development of medical textiles in order to make reusable PPE more attractive in terms of safety and comfort, and thereby to reduce the use of disposable PPE. This would go a long way towards reducing that portion of healthcare waste. Fourth recommendation is to support countries in the development of strategies and tools to educate health workers, waste handlers, and the general public in order to raise awareness on risks posed to public health and the environment by healthcare waste, and to promote safe healthcare waste management practices at every level. Fifth recommendation is to support countries in reviewing their national healthcare waste policy and regulatory frameworks, but I would say especially with a view towards strengthening national capacities to enforce compliance, because that is really what is seriously lacking. And number 6, the last recommendation here is to promote proper operation and maintenance of technologies for healthcare waste treatment and disposal, whatever type of technology is in use. There needs to strengthen capacity to sustain healthcare waste treatment technologies through adherence to standard operating procedures and effective maintenance practices. Again, this is very lacking in the field. In this slide, we can see the names of all the team members who have been involved in the study, and I would like to thank them all for their participation. Thank you all the participants for your attention. Now, we would like to ask the workshop participants to discuss these regional findings and recommendations for regional cooperation, and to please share with us your feedback, whether you agree or disagree with the findings and recommendations, or whether you would wish to add anything to them. Thank you all once again. It's been a pleasure.